Welcome to Ulosca channel. Access all nursing practice questions. RN Medical-Surgical HESI practice questions with answers.
Question 1. A client is admitted with heart failure. Which of the following findings should the nurse expect? A. Bounding pulse. B. Jugular vein distension. C. Bradycardia. D. Warm, dry skin. Which one is the correct answer? The correct answer is B. Jugular vein distension. Explanation. Jugular vein distension is a classic sign of right-sided heart failure. This condition causes blood to back up into the venous system due to the right ventricle's inability to pump blood forward effectively, increasing central venous pressure. Question 2. Which electrolyte imbalance is most commonly associated with loop diuretics? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypercalcemia. Which one is the correct answer? The correct answer is B. Hypokalemia. Explanation. Loop diuretics like furosemide increase urinary excretion of potassium, sodium, and water. This can cause hypokalemia, a condition that may lead to muscle weakness, fatigue, and serious cardiac arrhythmias if untreated. Question 3. A nurse is caring for a patient post-thyroidectomy. Which complication is most critical to monitor? A. Infection. B. Laryngeal stridor. C. Bradycardia. D. Hypertension. Which one is the correct answer? The correct answer is B. Laryngeal stridor. Explanation. Laryngeal stridor is a high-pitched, harsh sound that indicates airway obstruction. Following a thyroidectomy, it may result from vocal cord paralysis or hematoma and must be treated immediately to prevent respiratory arrest. Question 4. A client with chronic kidney disease reports muscle cramps and tingling. What imbalance does the nurse suspect? A. Hypophosphatemia. B. Hypernatremia. C. Hypocalcemia. D. Hypermagnesemia. Which one is the correct answer? The correct answer is C. Hypocalcemia. Explanation. In chronic kidney disease, phosphate retention leads to decreased calcium levels as phosphate binds calcium. Symptoms include muscle cramps, numbness, and tingling, which reflect increased neuromuscular excitability. Question 5. What is the priority nursing intervention for a patient with a pulmonary embolism? A. Administer antibiotics. B. Start chest physiotherapy. C. Apply oxygen therapy. D. Perform postural drainage. Which one is the correct answer? The correct answer is C. Apply oxygen therapy. Explanation. A pulmonary embolism blocks blood flow to parts of the lung, causing hypoxia. Administering oxygen is the first and most critical step to maintain oxygenation, followed by anticoagulant therapy as prescribed. Question 6. Which sign indicates digoxin toxicity? A. Increased appetite. B. Visual disturbances. C. Tachycardia. D. Constipation. Which one is the correct answer? The correct answer is B. Visual disturbances. Explanation. Visual disturbances like seeing halos, blurred vision, or color changes are classic early signs of digoxin toxicity. Other signs include nausea, vomiting, and bradycardia. Immediate evaluation and drug level monitoring are needed. Question 7. Which lab value should the nurse check before administering enoxaparin? A. INR. B. Platelet count. C. Hemoglobin. D. Potassium. Which one is the correct answer? The correct answer is B, platelet count. Explanation: enoxaparin, an anticoagulant, can cause heparin-induced thrombocytopenia, a potentially life-threatening condition. Checking platelet count before administration helps detect this adverse effect early. Question 8. What symptoms should the nurse expect in a client with left-sided heart failure? A. Dependent edema. B. Crackles in lungs. C. Jugular vein distension. D. Hepatomegaly. Which one is the correct answer? The correct answer is B. Crackles in lungs. Explanation: left-sided heart failure leads to pulmonary congestion due to the heart's inability to pump blood into systemic circulation efficiently. This causes crackles on lung auscultation as fluid accumulates in the alveoli. Question 9. A client with type 2 diabetes is scheduled for surgery. What is the most important pre-op action? A. Monitor urine output. B. Hold insulin until after surgery. C. Check blood glucose. D. Administer oral hypoglycemics. Which one is the correct answer? The correct answer is C. Check blood glucose. Explanation: checking blood glucose preoperatively is essential because stress from surgery can raise blood sugar, increasing the risk of infection, delayed wound healing, and poor outcomes. Managing glucose ensures better recovery. Question 10. Which is a priority nursing diagnosis for a patient with COPD? A. Activity intolerance. B. Ineffective airway clearance. C. Risk for infection. D. Imbalanced nutrition. Which one is the correct answer? The correct answer is B. Ineffective airway clearance. Explanation: in COPD, inflammation and excessive mucus impair the ability to clear airways, leading to ineffective gas exchange. Ensuring airway clearance is the top priority to prevent respiratory distress and failure.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.